Hello, 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 Facebook. I am Dr. Myla Bennett of Ederra Plastic Surgery in Johns Creek, Georgia. Sorry, I just came on and then I had a bad connection, so I tried to reconnect. So I'm back, and hopefully this time will be good. Hi, Tina. Hi, J. Michelle. So if you're on here, go ahead and share the video and let people know that I'm on. And I'm super excited to talk about this topic tonight because it was inspired by some new technology that I got to try out today and loved it. So I'm planning to purchase this new piece of equipment because it was awesome. Hi, Deborah. Wait a minute, that's Deborah. Sorry. Hi, Deborah. Hi, Montalvo, Larita. Hey, Sharon, Angela, Tisa, Crystal Clark. Hello, hello, hello. Oh, Crystal Chisley. Hey, girl. Oh, from Ohio, Dorothea. Where? What part of Ohio? I'm from Ohio. I'm from Cleveland. Hi, Juju. Hi, Rose. Everybody, please share the video and let people know that I'm on. Hi, Cynthia. This is a really, this topic is one of the things that people come in about the most, especially with people who lose a lot of weight. They'll have extra skin that even though the fat is gone, the skin remains, and it's not desirable. So, and then sometimes people still are a little bit fluffy, but their skin is not in the best condition. And so then when, hi Lori, hi Tisa. Oh, Dayton. Okay, my husband's from Dayton. Sometimes people just are just a little bit fluffy and they get liposuction and the skin may not shrink because the skin may not be in the best shape. So, this is one of those things that's a great modality for that. I'm from Youngstown, but currently in Columbus. Oh, sweet. Okay. I lived in Columbus for 11 years. I think Columbus is the best city in Ohio. Yes, this treatment that I tried today is great for loose arm skin. It's really great for any loose skin anywhere. So it's called Renuvion. It was renamed. It used to be called J Plasma, and they just renamed it to Renuvion. And it's a combination of radio frequency and helium gas. And the helium gas basically carries the radio frequency throughout it's like a carrier for the tissues, and it also cools so that the temperatures don't get too hot. So it decreases your risk for some of the thermal injuries that can happen with some of the temperature-based treatments. So up until now, really, a lot of the more popular things that we did for skin tightening non-surgically was things like O-therapy, radio frequency, but from the surface of the skin, thermage. So a lot of these things were created to tighten, but they do not give you the effect that this treatment that I did today does. And one of the reasons why is because it's happening from the surface, and these things are done without anesthesia, and there's only so much heat the person can tolerate. And a lot of these treatments require more than one, whereas this treatment, it requires one treatment, and you actually can see the results right there on the table, and then they continue to get better. So I had the opportunity to actually try the equipment out today on one of my lucky patients, and it was amazing. I was so obsessed with what I saw. Yes, Latanya, it's good for arms, thighs, belly, back rolls, loose skin on the neck. So I mean, this could cut down on facelifts and neck lifts and stuff like that. It's a non-invasive treatment. However, it's sort of invasive. So when I think of non-invasive for skin tightening, I'm thinking there's no cut to the skin and it's all done from the surface. This treatment is done great in conjunction with liposuction, but you don't have to get liposuction. But you have to actually make little punctures in the skin to get the probe underneath the surface of the skin, and then you activate the probe from like underneath inside of the skin. And underneath the skin, inside of the subcutaneous fat. And then when you activate the probe, it starts to treat the infrastructure underneath, and it causes tightening right there in your face. It's awesome. So awesome. So the cost, it starts at about $4,000 on top of the price of the liposuction. So if you're getting liposuction, whatever your liposuction cost is, add about $4,000 at least to it. It depends on how much surface area you're getting treated. So it starts as a $4,000 add-on to lipo. If you're not getting lipo, then it starts at $4,000. It could possibly replace the need for a tummy tuck, depending on why you need a tummy tuck. So if you need a tummy tuck because your muscles are really damaged, then that won't really work because it doesn't fix a diastasis. If you need a tummy tuck just because of loose skin, as long as it's not too much, it could totally keep a lot of people from needing a tummy tuck. Yes. So it doesn't melt the fat. No, melting the fat is different. This is about the skin. So it's not there to melt the fat. You don't have to melt the fat either. Like, melting the fat is really an unnecessary thing. Most of those treatments that melt the fat, the reason that they're doing that step is for skin tightening. And those laser treatments and vaser treatments that tighten the skin, you do get a little bit of improvement on the table. But when I've done laser liposuction with, like, in the form of smart liposuction. I've done that. And the type of tightening, really, you see it over time, is not necessarily something that you can appreciate on the table. But with this treatment, like, I saw the difference on the table. Like, the skin was contracting in my face. It was amazing. It was awesome. Yes, it can be used on arms and inner thighs. It could be used on back, sides, abdomen, neck, knees, anything that's loose. The recovery time is similar to that for liposuction. So, if you didn't get liposuction, you still would probably need to wear a compression garment afterwards. But I see this really being used in conjunction with liposuction. So really you have a couple days downtime from the actual procedure itself, and then your compression garment for 3 months afterwards. Okay, so it helps for loose skin, of all loose skin everywhere. Y'all keep asking me every single body part. Everywhere that there's loose skin, you can use it. You have the same marks that you have from liposuction. So just the little stab incisions, this little bitty, like 5 millimeter incisions. They're super small, millimeters, not centimeters, little incisions. It's called Renuvion, formerly known as J Plasma, Renuvion. I have no idea how far I am from Valdosta, Georgia. I am new to Georgia, so I don't know all these places. Usually I ask other people how far they are from me. I'm not sure how far I am from Valdosta, Georgia. What is the procedure called? It's called Renuvion. Hold on, let me type it. Renuvion. And it's formerly known as J Plasma. J Plasma. There we go. Yeah, it is really exciting. I'm super excited about it. I've literally thought about so many people that I wish I had it for people that I've done, some of the people that I've done before, to be able to offer that to them. The person I did today was so excited because I literally was planning to do her on Monday, and then when I saw her again, like right before her procedure, I'm like, the rep had told me I could try it out, and when I saw her, I was like, she's perfect for it. And I'm like, can we do you on Wednesday instead of Monday? And I moved her to today so that I could get the machine. So she got it without paying anything extra because I wanted to try it. People are always like, if you need a guinea pig, let me know. And I almost never need a guinea pig, but I needed one after I met that rep last week, and she was the first person I saw that was perfect for it, and so she got it for free. And I'm grateful that she let me do it. What if someone isn't happy with their tummy tuck? Like, let's say they still have loose skin. Can they use this, or is this only for people who haven't had surgery? Yes, you can get it. Yep. Yes, it's a service I offer. $4,000 per area. I'm not really sure how I'm going to do it. I know depending on the amount of surface area, it'll cost more because it's actually a little time consuming. I treated her mid back, like where she had bra rolls, and it added another hour onto the procedure. So if somebody's trying to get like a lot of area tightened, it'll add up because I can't just be standing there all day working on somebody for the same price. So I'm very far from Valdosta. Oh, okay. Yeah, Kybella is I'm not on the Kybella train. I don't get why people do Kybella. You could just get chin lipo, and it's like it takes 5 seconds and it's done. You don't have to keep on getting it, and you still get swelling. Like you get swelling with Kybella, and you get swelling with lipo, except it's gone. I just don't get why people do Kybella. Like I just don't get it. It hurts. You swell. You have to get more than one treatment. Sometimes it don't work. Oh, 3.5 hours from Valdosta. Okay. I think the treatment is better with lipo for people whose skin is damaged. I wouldn't say every person who gets lipo needs it. I don't agree with that. Because some people's skin is great and you can tell it's going to shrink. And so I think one of the places that it'll be really powerful is in people who have lost a lot of weight. Or women whose bellies are actually pretty flat, but they just have extra skin after babies and they don't want a tummy tuck. Thighs, because inner thighs is one of those places sometimes people will get lipo, and then the skin, because the skin in your inner thigh is kind of thin, sometimes it doesn't want to shrink. I think it's going to be great for necks and chins. What do you mean open drainage, cocoa or cocoa? Hey, Tamara. Oh, you so sweet, Catherine. No, I don't have before and after pics yet because I just did it today. But I asked the rep to give me some of their before and after pics so I can share some of what it can do. So I'm waiting on him to send me some. Thanks, Dorian. I have been, I got a little bump right there on my forehead, but I've been trying to get my skin back right after I had my baby because it went in the dumps while I was pregnant. So it's starting to get back to normal. If you don't live in Georgia, I wouldn't require you to stay for 2 weeks because essentially it's like liposuction. But you need to plan for 5 to 7 days depending on how far away you are. It's permanent, Jocelyn. So as long as you don't go and gain a bunch of weight back and stretch the skin back out with life, and actually after the treatment you continue to get contraction for several months after the treatment. So you get contraction on the table and then it keeps shrinking the skin. So the recovery is short, like a couple of days. Why can't anyone do work on a paraplegic? I'm not sure why. Being paralyzed is not technically a contraindication, but if it's something else going on, and I guess it depends on what work you want done and where. Oh, you got Kybella on your thighs? I learned to love my body because I don't that much money like that. So to be clear, this can be done in place of lipo. No, it's not in place of lipo. It's for skin tightening. Liposuction is for fat removal. This treatment does not remove fat. It just tightens skin. So it can be done in conjunction with lipo, or it can be done separate from lipo. If your issue is not fat and your issue is just skin, then you can do it without doing liposuction and just tighten the skin. It's also good for resurfacing the skin on people, not for ethnic skin tones, but for, Caucasian people. If they have like a bunch of wrinkles on their face or a bunch of sun damage, you can do resurfacing of the skin with this treatment also. Actually, Tamara, yes. Yep, we sure can. I'm talking about Renuvion, formerly known as J-Plasma Skin Tightening. Yolanda, that's a great question. So the risks to the procedure, the biggest risk I would say is probably you could technically get a burn with any type of thermal-based treatment, but it's extremely rare because the helium that is used to carry the radio frequency through the infrastructure of your skin cools at the same time. So there's definitely, you can overdo it. Like there's setting, you can choose the settings that you want, and as the doctors get more comfortable with the treatment, they may become more and more aggressive with the settings. And so if you go too high on the settings, you could burn the person, which is the same type of complication you can get with laser treatments, like laser liposuction and stuff like that. It'll be similar. Well, if you get liposuction with the treatment, if you get liposuction and the Renuvion, you will have like the exact same recovery as liposuction alone. It'll be the same. If you just get Renuvion, I'm not sure about how painful it is afterwards, because I don't think it doesn't beat you up quite as bad as liposuction does. Liposuction is, you get beat up. Like that cannula is in there just going crazy for, a couple of hours. And so your muscles feel really banged up afterwards. And with this treatment, it's not so aggressive like that. But if you're doing it with liposuction, the pain that you would feel would be from the lipo, not from the Renuvion. Oh, thanks, Tiffany. It is exciting, Deanna. I'm so excited. All right, sweet Tamara. I can't wait to see you. How you get it? I do both virtual and in-office consultations. And all you have to do, hold on, I'll type my website in. You can hit up my website at www.ederrabella.com, or you can call my office at 678-325-0006. So I just put both of those up there. And I do charge a consultation fee. My consultation fees are $150. And if you elect to proceed with surgery that day of your consultation, the $150 will come off the price of your surgery. But I don't do free consultations. So don't call and be surprised when they ask to take your payment for consultation, because you can't make an appointment for consult without paying the consultation fee. Just FYI. She did not have stretch marks. She just had, her skin was just loose, but she didn't have stretch marks. But it'll still tighten your skin even if you have stretch marks. If you've already had lipo, I would recommend waiting like 9 to 12 months before you try to do this, because you'll have a bunch of scar and it'll be hard to push through the tissue if you just had lipo like 2 months ago. You kind of need to let your tissues calm down before going back in there trying to do stuff like that. Miss Rhea, yes, I would consider a tummy tuck in a very well-controlled diabetic. If your diabetes is in great control, Sophia, it's safe. A person is down for a couple weeks after a tummy tuck, Larita. Thank you, Duran. You can be awake or asleep during the procedure. The patient I did today was awake. Smooth stretch marks. It's not going to change the way your stretch marks look, but it will tighten your skin overall. Unless you're a white person. Now, you know what? Actually, Yeah, it looks like your picture, Margaret West. It actually may help your stretch marks because you can get treated from the surface. So people who have more fair skin, surface treatments can be done, and it helps with the appearance. It's an ablative treatment for the surface of the skin. So it actually could make your stretch marks look better. Rhonda, it's 9 to 12 months after any lipo type of procedure, whether it's laser or not. I don't have my own recovery home. I have a person who is setting up one to service my clients, and it'll probably be ready to be used in the next month or two. I'm not hiring right now, Sade. You need to stay in town for 5 to 7 days after the procedure for lipo type procedures. So this procedure too will be 5 to 7 days. What if the skin isn't loose, like hard, or rather firm stomach, like a lot of scar tissue that is causing you to have a LOL tummy? I don't understand your question, Brandy. Yes, liposuction more than any procedure requires your hemoglobin level to be, it's not your iron level that we care about, it's your hemoglobin level. But you need iron to make hemoglobin, and so that's why, iron, that's why usually when people's hemoglobin is low before surgery, they have you take iron. It's not necessarily that your iron is low, it's that your hemoglobin is low, and you need iron to make hemoglobin. So, but with liposuction, you lose more blood in liposuction than any cosmetic procedure that we do. Gives you the highest blood loss. And the reason why is because we're not able to see the blood vessels that are damaged, and we can't stop the bleeding. So you bleed more. It's a blind operation. If I do a tummy tuck, I can see something bleeding, and I'm going to take my Bovie and I'm going to burn it and stop the bleeding right there. So with tummy tucks, you don't lose a lot of blood. So I would be more willing to do cosmetic surgery on a person whose hemoglobin might be a little bit low if they're getting a tummy tuck before I would be willing to do it on a person getting liposuction. Liposuction, you absolutely must have your hemoglobin at a good level. Rachel, no, you could just call the office and I can look at your pictures again and see if you're a good candidate. You don't want to tighten scar tissue. That doesn't make sense. Rochelle, tightening scar tissue doesn't make sense. Okay. Jennifer, we're talking about Renuvion, formerly known as J Plasma Skin Tightening, and I tried it today in my office and fell in love with it. So I'm going to be offering this technology now in my office, and so I wanted to share about it. LaTanya, talk to whoever you are getting surgery from about your hemoglobin level. Yes. So Aaron Perkins Spikes, yes, that's exactly what it will be helpful for. Loose skin. Had a hysterectomy and had 2 surgeries before that, 4 tumors. But workout so stomach isn't loose. But the tummy I have is hard. Was told I have a lot of scar tissue, which has caused me to have a tummy. So your tummy being hard this treatment is not for that. It's for loose skin. So if you don't have loose skin, that's not what this is for. You have to be a surgeon to do this treatment. It's invasive. You have to be a doctor. And it's going to be more effective than the treatments that can be done by other people who aren't doctors, because it's actually going underneath the skin to treat the skin from the undersurface. It's it's more invasive. So it's a procedure that has to be done by a doctor. I don't have my own lab, but we have our patients. I'll write a script for people to go to LabCorp or something, and LabCorp will fax me the test results. Or sometimes people will get their regular doctors to draw the labs. I do it both ways. Lifting weights before surgery is fine. I wouldn't necessarily say it's better than a thigh lift. It depends on what you have going on. People always ask stuff like that. So is lipo better than a tummy tuck? Or is this better than a thigh lift? It depends on the patient. In some patients, it might be better. It might be a better option than a thigh lift. If you just have a moderate amount of loose skin and you don't. But if you have a whole bunch of, like, your whole thigh is draping, it probably would be better to get a thigh lift. It just depends. So it's not a one size fits all answer to that question. In the right person, it could be better than a thigh lift. And in a different person, a thigh lift could be better. This procedure starts at $4,000. Hey, Dr. Valika. You're welcome, Latanya. Nope, I'm not open on the weekends. Absolutely not. That's for my children. I'm open Monday through Friday, and Friday I'm only open until 1. Yep, Sherry, this procedure does apply to loose skin on the arms. If you need arm lipo or arm lift by consulting with your surgeon. So people ask stuff like that all the time. What you need to know is what bothers you. And then you need to find somebody that through your research you think you can trust, and then you use their professional opinion and combine with what you are willing to do and what your goals are to come up with the right treatment plan. Thank you, Tiffany. Do you have scarring that shows from under the skin, laser on darker skin? I don't understand the question. Hi, Tale. Roberta, ask me the question again a little bit different way, because I'm confused a little bit about what you're asking. My office is in Johns Creek, Georgia. It's a suburb north of Atlanta. Roberta, are you going to type and ask the question a different way so I can answer you before I log off? Thank you, Rachel. You're numb, so you get tumescent anesthesia the same way you do for lipo. So you're numb for the treatment. I'm from Cleveland. But I haven't lived in Cleveland since I was 18. When I graduated from high school, I went to college and I never moved back to Cleveland. Oh, some procedures that include lasers leave marks that you can see. Do you mean like the incisions? Outside of the small stab incisions that are used to get in and underneath the skin, marks should not be left behind. I'm booking already in October. If you want, my fall dates are actually going. Fall and winter, I only have a few more dates left in November and December. So if you want surgery in October, you need to be getting your date locked up now. Hopefully, we still have whatever date you want. Just wondering if that's a consideration or no. The only scars that you should have are the ones from the stab incisions, which is the same ones you have for liposuction. And those usually heal pretty nicely. I am, like I said, my July is full. I have 1 or 2 dates left in August. I think I have dates in September, but October, November, December are all getting jammed up. Yeah, if you want to get surgery in the fall, you need to be seeing me now. And then I have a little wait list for people who want surgery sooner, because if people's hemoglobins come back off and stuff like that, then dates will open up. So if you want stuff, you like anytime in 2018, you really need to have seen me already. You need to get in like yesterday. Yes, I do etching, Trista. Yes, Delia, that's what this whole video is about, J Plasma. So Renuvion is what I was talking about, but they renamed it from J Plasma to Renuvion. It's the same thing, and that's what I did today. I tried that machine out today for the first time and absolutely fell in love with it. And so now that's a treatment that I'll be offering in my office. The blood work that you need before surgery depends on your medical history. It depends on what you have going on. My BMI requirement for liposuction is 33 or less. Oh, Roberta Sweeper. Okay, so no, you should not have that. That was a complication. It shouldn't have been that way. When you get laser liposuction, you shouldn't see everywhere the laser went underneath your skin. That means they were burned. So that it shouldn't be like that with this treatment. I need an explantation. One implant is collapsed and the other has capsular contracture. Can we do skin tightening at the same time? Yes. There's a risk of hardness or lumpiness really with lipo. I guess technically you could get that with this because that's scar tissue, but that's more of a risk of liposuction. So if you get liposuction first, then that is a risk. For a tummy tuck, I would recommend being at least 6 months postpartum. I would say that your hemoglobin A1C needs to be below 6. That's for my patients, but that is surgeon dependent. So that's something that you need to go talk about with the surgeon you choose. All right. I guess we're winding down, y'all. So I'm trying to think. I hardly ever offer specials. But I'm thinking about offering one because I want to do this treatment because it's fun. I had fun doing that today. It was it was so exciting. Like my staff kept coming in, looking, and they're like, oh my God, oh my God, oh my God. It was exciting. And I want to do more of it. So I might offer a little special. So stay tuned. I might offer a little special for that so I can do some more of it because it was fun. Would it be ideal to have this procedure in combination? Yes, Delay. We did talk about that earlier. It's a great. I see that it being used that way the most, as a combination with liposuction. Thanks, Tiffany. Yeah, I do love what I do. I love it. Dina or Deanna, I'm not sure if I'm pronouncing your name correctly. It's great for people who lost a lot of weight. It's so great. The procedure it took me an additional hour on top of the liposuction to treat that area. Hey, Lori. When did I know I wanted to be a doctor? When I was in the 4th grade. Yep. I had eczema really bad when I was growing up, and I used to go to the doctor all the time to get cream for my eczema, steroid cream. And my experiences going to the doctor made me want to be one, but the thing that actually kind of sealed the deal for me was actually a negative experience with a doctor. And it was actually a racist doctor. And I was in the 4th grade, and he told my mother that my eczema was nothing that a little soap and water wouldn't cure. And when he first said that, I thought that, I'm like, yes. I was a kid, and I'm like, when we got out, I'm like, Mommy, he said that it could be fixed with soap and water. And she was like, no, baby, that's not right. Like, and so that was one of my first experiences that I can remember of racism. And I remember thinking that I want to be a good doctor. Like, I want to be a nice doctor. Because when I understood what it meant after my mother told me what the person really meant, I was like, people shouldn't feel like that. My skin was something that I struggled with my entire childhood. And we were going there for help, and he was trying to insult me. Like, I can't wipe the black off my skin. That's the code. That's who I am, and it was just mean. And I remember thinking that I'm going to be a nice doctor. I'm going to be a good doctor. But now it's so ironic because I hated my skin when I was little, and now my skin is what makes me money. I get compliments on my skin daily, and I used to get teased about my skin daily when I was little. It's so crazy the way God does stuff. What about dents in the buttocks? Can this be reversed? You go under the skin and break up the fascia. It can possibly be reversed. I gotta see it. I really want to thank you so much for educating me. My hubby is RN. Sometimes he speaks medical. LOL. You're welcome, sweetheart. Thank you, Monica. Esta, yeah, if you wanted the tightening of your arms and thighs, that will probably be about $8,000. Yeah, people can be mean, but it's life. I've had some really messed up experiences with racism over the course of my life, and one of the worst ones actually pushed me to move to Atlanta and start my own practice. So I kind of embrace all the experiences I have, whether they're good or bad, because I feel like if I take them and use them and force them to be used for something good, then it didn't happen for nothing. So, yep, turning a negative into a positive is one of my specialties. I'm so good at that. Like, I immediately, when something is not going the way I want it to, I immediately try to figure out how to make it work for my good. Like, I've always been like that. It's not something I was taught. I have always been wired that way. I don't know why. I'm grateful that I'm wired that way, but so that doctor helped me become a doctor. That racist doctor. It depends, Edith. It depends on what your inner thighs have going on. So if it's only a skin thing, yes, it will be great. But if you have fat too, then you would need both. Thank you, Lanika. Yep, a waymaker. Thank you, Michelle. Facials at least once a month, Lori. Lymphedema, is that what you're talking about, Roberta? This is not for lymphedema. I don't take care credit. I take Alpheon, Lending USA, and United Medical Credit. Stasha, I was talking about Renuvion, formerly known as J Plasma, for skin tightening. It's an amazing treatment. Talk to your surgeon about that, Michelle. About when you can waist train after your tummy tuck. Thank you, Vicky. Let's see. Yeah, what is the procedure called? Tighten the skin. Renuvion, formerly known as J Plasma. Wow, you've been watching me for 2 years, Tiffany. Thanks. Thank you. Do I attend Essence Fest? I've never been to Essence Fest. I've never been to Essence Festival. Every year I say I'm going to go next year, and then I look up and it's time and I haven't planned for it, and then I don't get to go. Right, Sharon. My BMI limit for tummy tuck is 35. Melissa, this treatment can tighten the skin under your chin. Like, that's another thing I'm really excited about for this treatment. So, if you have like loose skin under here, it'll tighten that right on up. The only way I would do it in multiple sessions is if you have a whole bunch of areas that need to be done. Why do you need an ice pack after your tummy tuck? It's kind of dangerous because you're kind of numb. So you can end up like getting frostbite if you don't feel that it's too cold and move it. Oh, Angela, tell your husband I said thanks. I just want people to, obviously I want people to come to me, but I don't think everybody is for me. But part of the reason why I do these videos is so that people are educated on how to do things safely so that they can make the best decision for themselves with whoever they choose. So, if you come to me, awesome. If you don't come to me, just be safe. I want people to come out of the procedure alive with as least complications as possible or no complications and a result that they love. Yes, Sharon, let's do it. Yes, they are. Yes, you can be put to sleep for this. Absolutely. Yes, you can use this for flaccid skin. That's how you spell it. Yep. You only need one treatment. One. So plain radio frequency, you have to get like 5 or 6 treatments. And they have to be like a week apart. This treatment, you get one. And it shrinks it up. And then it keeps shrinking after the treatment. If it will help with pain, no, it's not going to change the amount of pain you have. Yep, you can possibly get your stomach, arms, and neck done in the same treatment. It depends on how thick you are. Also depends on if you're awake or asleep. I could definitely get more areas done if you're asleep in one session. Oh, thank you, Tiffany. I have virtual consultations, Aaron. Yes. Sweet. Yeah, girl, I can't stand. I ain't gonna say I can't stand Kybella, but I have not got on the Kybella train. I'm just not. I don't get it. Especially not for the chin. Like, just do lipo. It takes more time to come to the office, get signed in, and all of that other stuff than it does to actually do the liposuction for chin lipo. Like, with Kybella, you got to get more than one treatment. You get all the swelling. It hurts. It's just like, for what? Chin lipo don't even hurt. Yeah, Trina, I'm not really down with the DR. I got a lot of folks who hate me too because of that, but I don't know Dr. Manning specifically. I don't know what kind of work that person does. I just know in general that, and I'm sure there's some great surgeons in the Dominican Republic. I'm not talking about the good surgeons. I'm talking about the plastic surgery factories and the people who get really horrific complications and bad infections and end up in ICU or end up dead. And it happens a lot in Dominican Republic. And now Miami is almost just as bad as the Dominican Republic as far from a safety standpoint. So I don't know Dr. Manning or anything about that doctor's work, so I can't speak on that. But I just know that in general in the Dominican Republic, there's a lot of bad complications and deaths that come from that place. So be careful. That's what I got to say about that. Thanks, y'all. Is it more money if you're asleep? Yes, it's more money to be put to sleep because you have to pay for OR and anesthesia fees. Plus, like say you're getting put to sleep for just liposuction. So let's say you're getting lipo 360. So for me to do lipo 360 on a normal sized person, that's going to be about 2.5 hours of OR time. If I'm adding this, if you're getting the lipo and then I'm doing this skin tightening, it might be 3.5 or 4 hours of OR time. So you're going to be paying for more OR time. Plus you have to pay me to do the treatment. So it definitely costs more, but we want to do the best thing for you. Not fibrosis, I don't think. No fluid. I need neck, arms, inner thighs right around the navel area. Looks like light scar tissue, not for... Yeah, this isn't for that. With chin lipo, I have my patients wearing a compression garment 24/7 for the first week, and then after that, they need to wear like 12 hours a day for like a month. I don't give prices over Facebook, but my liposuction starts at 4K. I do liposuction in my office with people awake a lot, but when I'm doing like tummy tucks, breast surgeries, things where people are put to sleep, I do that at a hospital, Northside Hospital. Hi, Regina. Good evening. What were the skin tightening things that we can do without surgery? So you can get radio frequency skin tightening, and there's a bunch of different platforms that have radio frequency. My platform is called the IndyMed. Then you can get like thermage. Well, I don't even think people still do thermage, actually. Therapy is people definitely still get that. There's lasers that tighten the skin. And then obviously you could do surgery. I don't have any before and after pics of this treatment because I just tried it today for the first time. So I asked the rep to send me some before and after pictures of other docs who have already been using the technologies for me to share what it can do until I get my own photo gallery of these treatments. If you want to be put under for lipo 360, you can be. You don't have to be. But I have just changed my policy for if your BMI is over 30. So if your BMI is 30 to 33, you got to be put to sleep. If your BMI is under 30, you have the option of getting awake liposuction in my office. This whole video, Sabrina, is about J-plasma, so you want to just catch the replay. Nikki Woods, you and Sabrina need to catch the replay because y'all asking questions from the beginning. So it's about time for me to sign off because I'm getting questions. I'm getting the same stuff I already answered. And that way you guys can, if I get off, y'all can go and start watching it over. Don't be mad, girl. I'm going to talk about this one again because I love it. And once I really get fluid with it, then I'll do a video showing you guys the treatment. I'm going to be talking about this one for a minute because I'm kind of obsessed with it already. Like, I'm so excited about it. I was so impressed with what I saw on the table today. So impressed. It was awesome. So, yes, I love it. It was great. Like, the lady's skin was shrinking in my face. It wasn't like, okay, we're going to wait and see what happens. And she's going to get more shrinkage. Ooh, blood thinner is a bit dicey. I'm not seeing how blood thinner is going to be a major issue. I think you might not be able to get it. But it depends on why you're on it and if you can come off. And chances are you can't come off. But that's not a question I can answer on Facebook. I hope your plastic surgeon in Minnesota that you're talking about is actually a plastic surgeon. Because there's one person who's a cosmetic surgeon in Minnesota who does this that is not a surgeon. They're playing surgeon. So I hope you're going to a real plastic surgeon and not a cosmetic surgeon who's really a family practitioner. Be safe. The new treatment is J-plasma. It's called, they changed the name from J-plasma to Renuvion. Yep, I see those. Yep, y'all got to pay attention to what's going on out here. Y'all got to pay attention. Just because somebody got a bunch of followers on Instagram does not mean that is a place to go. And the way people have been getting hurt, and I'm not saying that person hurt anybody, I don't know. But the way people have been getting hurt, a lot of people have been getting hurt. And a lot of people have been dying. No, most cosmetic surgeons aren't real plastic surgeons. Some of them aren't even surgeons at all. Plastic surgeons call themselves plastic surgeons. They usually don't call themselves cosmetic surgeons. Usually when people say cosmetic surgeon, it's because they're trying to trick you into thinking that they're a plastic surgeon. So when you see cosmetic surgeon, dig deeper and find out what kind of doctor they really were trained to be. And if the answer is family practitioner, ER doctor, dermatologist, whatever, OBGYN, and they're telling you that they do liposuction and tummy tucks and BBLs, steer clear. Yes, you can go to the National Board of, it's the NB Medical Specialties, National Board of Medical Specialties, and type their name in, and it'll tell you what they really are trained in or board certified in. So asking a doctor if they're board certified is not enough, because they'll say yes. What you need to know is if they're board certified in plastic surgery, not cosmetic surgery. Are you board certified by the American Board of Plastic Surgery? The word plastic needs to be in the board, not cosmetic. The cosmetic surgery, the cosmetic surgery board is a made up board and is not recognized by the National Board of Medical Specialties. And that's for people who aren't real plastic surgeons. I personally don't know any plastic surgeons that are board certified by the American Board of Cosmetic Surgeons. There's no point, because we're board certified by the American Board of Plastic Surgeons. We don't have to trick anybody. We actually are plastic surgeons. Other people are just trying to hit a lick. They're trying to make a come up. They're trying to make some cash. So they're dabbling in plastic surgery, or some of them have tried to turn their whole career into plastic surgery because they want cash and they hurt people. A cosmetic surgeon, 9 times out of 10, is a person faking being a plastic surgeon. The cosmetic part is there to trick you. So be careful. If you see cosmetic surgeon or cosmetic physician, I see that really boils my blood. I'm a board certified cosmetic physician. The hell is that? It's an imposter. If it says I'm a cosmetic physician, run for the hills. No, they can't go to jail if they operate on you. If you go and sign a consent form and say, yes, I'm letting this family practice doctor do my surgery, they're not going to jail. It's not assault unless you don't sign a consent form for it. Because a doctor is technically allowed to practice medicine on a person. When we graduate from medical school, we all go down different pathways. We match into residencies in different specialties. And you're supposed to be ethical and practice in that scope of the things you were trained in. Some people want money because plastic surgery is a lot of, cash. And so they start doing another specialty that they're not qualified to do. They can't become board certified by the American Board of Plastic Surgery. They're not allowed to even sit for our boards if they haven't been trained in plastic surgery. And you can't train in plastic surgery in a week or a weekend. It took 6 years for me to be trained to be a plastic surgeon after medical school. So somebody trying to reduce it down to a weekend course is tripping. Yep. I can't tell you how many people end up in my office jacked up from going to, and I'll be like, was it a plastic surgeon? They'll be like, yeah, it was a plastic surgeon. I'm like, what's their name? Then they'll tell me their name, and I'll pull out my phone and type their name in, and 30 seconds later, I'm like, that's not a plastic surgeon. That's a dermatologist that you just let do your tummy tuck, which is why your belly look like that. Or no, that's not a plastic surgeon. That's a family practice doctor. And this would explain why you have these burns running all up and down your belly. It's no good. Exactly. Bad doctors mess it up for good doctors. If you're a doctor, Alana, you have to be a doctor still. So if you're not a doctor and you're doing surgery, you could go to jail for that. But if you're a doctor and you're doing surgery, a medical doctor and you're doing surgery, and people let you do it, then it's up to you to make sure you're in good hands. So check the American Board of Plastic Surgery site. And you can type in, it'll say, is your physician board certified? And you can type their name in. And if it doesn't come up that they have taken the boards, then pick somebody else. Yeah, y'all, people been getting tricked and hurt. But I anticipate that in the next 5 years or so, there's gonna be some legal things set up to keep doctors from practicing that far outside of their scope. So just be careful, y'all. Don't be looking for the cheapest person and all that other stuff. That's how you get killed. It's not the time to bargain shop. If you can't afford to get it, just don't get it. It's better to have your belly stretched out and you be alive and there for your family and your children, because even a belly with some stretch marks on it or with some extra skin, that's still normal. Like, that's still normal. Like, it's normal for a mom to have remnants on her belly that she had a child. But when it's all burned up and stuff like that, that ain't normal. That's not normal. So, it's better to just have your normal imperfections than some horrific complication that isn't normal. So it's just, if you can't afford it, it's fine. Everybody can't afford it. Don't go and do desperate things to get it and end up hurt or dead. Because the stuff that lands in my inbox that people have that they're trying to get fixed is sad. It makes me sad. I'm like, wow. And it's always, not always, but a lot of times, it's oftentimes because they're trying to get it cheaper. Work with resident fellows that are in training in the OR for years. Yes, it's literally in my residency, I operated every day, even on the weekends. Like, your whole life is the OR, and your whole life is managing the things that come with surgery. Like, it's more to surgery than actually doing the surgery. You need a person that understands the physiologic changes and stuff that happens with surgery so that they can manage you after surgery, know what to do before surgery so that you're primed for surgery. Doctors who weren't trained surgically have no idea about that stuff. Like, the way we think about stuff is totally different. And I'll give you an example. So doctors, when they graduate from medical school, we go down one of two tracks. It's called medical or surgical. So all the surgical specialties obviously are going down a surgical track. So you do rotations in the different surgical specialties, but you're in the OR and you're managing patients pre-op and post-op after they get these procedures and the complications that come with that, and you're doing it on a massive scale. Then you have the people who go down the medical track. So that's going to be family practitioners, dermatologists, ER doctors. These are people who are managing people's health without surgical issues. If a person has swollen ankles and they just had surgery, the reason for their swollen ankles is way different than the reason for their swollen ankles if a surgery isn't in the mix. So what ends up happening if you're on a service in the hospital that is a medical service and you have a bunch of swelling, they're going to give you Lasix to try to push some of the fluid out. If you're on, or look, swelling's not a good one. Let's say urine output. Let's say you're not peeing enough. If you're on a medical service and you're not peeing enough, you're not putting out enough urine, they will give you Lasix to make you pee more. If you are on a surgical service and you're not putting out enough urine, we're going to give you fluid, which is the opposite of Lasix. Because the reason that you're probably not urinating is because you don't have enough volume in your blood vessels. Well, with the medical, if you're going down the medical track and you haven't had surgery, the reason you're not urinating might be because of having too much fluid in your, it's called interstitial space. And so they're trying to pull that fluid into your vessels and out. It's different. You're not volume depleted. You have the volume in your body. It's just not in the right place. So they're going to do a treatment that's going to help put the volume into the right place, but the volume is already there. But if you've had surgery, you may have lost a whole bunch of blood. And so you actually don't have the volume. So we're going to use fluid and maybe blood products to get your urine output up. It's a completely different way of thinking. You want a doctor whose mind is in the right place to take care of your body after you had surgery, not one whose brain is wired to think a completely different way. That's why people end up in all of this mess. Or someone who, if you get some complication, knows how to treat it. You need to be in the hands of a person who is qualified to do what I'm not qualified to do your brain surgery. I'm not qualified to manage your kidneys. I don't know about that. I can't be in charge of your dialysis. I can't deliver your baby. So why you want your OBGYN doing your breast dog and your family practice doctor doing your tummy tuck? Because they're not qualified to do that. I'm not trying to do their stuff. I'm going to say, if you need a regular doctor, I was going to say a real doctor. I'm a real doctor. If you need a regular doctor or a primary care physician, I can't replace that. I'm going to get a primary care physician to help me with things if you have real issues. Or I'm going to say, listen, until your primary care physician says you're good, you got to pass their test first, and then you got to pass my test to get surgery. You don't want to be having this kind of doctor doing that kind of work when they're not trained for it. Just because they're a doctor doesn't mean they're supposed to be doing something. So yes, can you do tickle lipo is fake lipo. Thank you. All right, y'all. I've been trying to get off for a long time. I'm really gonna right, because he ain't no plastic. I knew who it was. I'm not saying no names, but I knew who it was, and don't even think about going there, girl. Just don't do it. I have a sculpture machine. Sculpture works if you get multiple treatments. So they make it seem like you can get one treatment, and one treatment is not going to do it for most people. You really need a couple treatments. But if you get a few treatments, it works. Right, Danielle. What is your life worth? Exactly. See? Real time. Sabrina just looked up somebody. I knew exactly what she was talking about when she said the state. And that somebody is not a board certified plastic surgeon, because that somebody is not a surgeon. He's playing surgeon. How can you tighten loose skin? Okay, Angie, when I get off, watch the replay and I'll talk all about it. I need to get off. Somebody inbox me. Oh. Not for surgery. Go there if you need to get your blood pressure checked, Sabrina. If you need to have your diabetes managed or your blood pressure checked, or, you got a cold and you need some medicine, that's where you should go. But if you're talking about plastic surgery, absolutely not. Cool sculpting is good. All right, y'all. I'm getting off for real this time. I've got folks that hate my guts. Some of these doctors can't stand me, but whatever. So I am Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa. Oh, wait a minute. So y'all see this Preserve Your Pretty shirt? So this is my old Preserve Your Pretty shirt. I should have had on one of my new ones. So I just got a new batch of Preserve Your Pretty shirts. I need to take some pictures and show y'all. They're so cute. I have tanks, and it's not pink. It's like my Ederra blue color with Preserve Your Pretty on it. I have tank tops, and I have the off-the-shoulder little like yoga type shirts. So if you want to order a Preserve Your Pretty shirt, call my office. Exactly. Okay, so that doctor trains non-surgeons all the time for like a week. Like, it's bull crap. I don't know why he's doing that, and I don't get that part. I think it's bull. But he didn't do a residency. He's not a plastic surgeon. He can't do plastic surgery. He can't do the plastic surgery boards. He did not do a residency. He did like a little training with Dr. Miami for like a week or something. It's not a residency. If you haven't done a surgical residency, you can't even do a plastic surgery fellowship. Like you can't do an accredited fellowship if you haven't done a surgical residency first. My Instagram, I have two. One for my business. It's Ederra, EDERRABELLA. And then I have my personal one is Dr. Myla, DRMYLA. All right, y'all, for real, I'm getting off. So I'm Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.ederrabella, EDERRABELLA.com. Or you can call my office at 678-325-0006. Aw. Okay, y'all. I will check y'all later. Look out. Pay attention because I'm actually probably gonna run a special. My special for 2018. I usually have one little special a year. It's about time. And it's probably gonna be on the skin tightening. So keep an eye out. Hey, mommy. Ma, you up this late? Y'all, my mother on here. She's never on with me because she's always passed out by the time I get on. All right. Good night, everybody.